How does a gluten challenge impact tTG-IgA and EMA test results? Imagine trying to solve a puzzle where some pieces only show up after a certain time. That's similar to what happens when you do a gluten challenge to test for celiac disease. When someone has been avoiding gluten, their immune system quiets down, and the blood tests for antibodies like tissue transglutaminase immunoglobulin A and endomysial antibody might look normal. But reintroducing gluten can change that picture. During a gluten challenge, a person eats a controlled amount of gluten daily, usually about 3 grams. That's roughly 1.5 slices of bread. The goal is to see if the immune system reacts by producing more antibodies. However, these antibodies don't spike right away. It can take several weeks for the immune response to become strong enough to be detected in blood tests. Typically, blood tests for tissue transglutaminase immunoglobulin A and endomysial antibody are done at intervals, like 2 for weeks after starting gluten. Sometimes, tests are repeated at 8 to 12 weeks. If the person's antibody levels go up during this period, it's a sign that gluten is triggering an immune response, which supports a diagnosis of celiac disease. It's important to know that not everyone with celiac disease will show positive antibody tests during a gluten challenge. Some people have what's called seronegative celiac disease, meaning their antibody levels stay low or negative even if they have intestinal damage. So, a negative test doesn't always mean the person doesn't have celiac disease. In some cases, the immune response might be delayed or weaker, so doctors often recommend multiple tests over time. This helps confirm whether gluten is causing the immune system to react. The process can be a bit slow, but it's essential for accurate diagnosis, especially if someone has already started a gluten-free diet before testing. In summary, when gluten is reintroduced during a gluten challenge, the immune system in people with celiac disease begins producing more antibodies like tissue transglutaminase immunoglobulin A and endomysial antibody. But these levels don't rise immediately. It can take several weeks for the antibodies to become detectable, so repeated testing over time is necessary. This helps doctors decide if gluten is causing the immune response and confirms or rules out celiac disease.